Hi everyone! Today we're going to be talking about the hip joint, and we'll be taking you all through a hip mobilization that you can do on your own at home to both help improve the mobility of your hip and to help decrease pain. So, one of the most common compensations we see during a bike fit is actually decreased hip mobility or hip range of motion that can lead to all sorts of compensatory patterns on the bike. So, low back pain, knee pain, foot pain, shoulder pain, all sorts of things. When you don't quite have that hip flexion range of motion. So depending on what kind of rider you are, what kind of bike you're riding, especially in a time trial position where you're more aerodynamic, we like to see at least 120 degrees of hip flexion range of motion. So when you don't have that, or you have pain at end range, oftentimes this is accompanied by what we call hip impingement or femoroacetabular impingement. So what does that mean? So here we have a model of the pelvis. We have the acetabulum here, the hip bone, pelvic bone, and then the femur here, which is the thigh bone. So when we talk about hip impingement, we're talking about, what happens at this contact point here with the head of the femur and the acetabulum. So oftentimes, especially in a hip flexion range of motion, here, the head of the femur makes too much contact with the acetabulum here. There's just decreased joint space, and that can create pain, that can create stiffness, decreased range of motion, all sorts of things. So the whole goal with this mobilization technique is to help increase that mobility and to help increase space at the joint. So by creating a little bit of distraction, a little bit of gliding, we can open up some space in the joint so that hip flexion range of motion is just a little bit easier and more pain-free for you. So for the hip mobilization, the only thing you need is a resistance band. So this is a pretty heavy one. I think it's 50 to 125 pounds of force. So you want to tie it to something that's sturdy, that's not going to move when you apply that traction. So I'm going to slip my leg through here, and then if you want at home, if you have like a foam pad or a pillow, something you can kneel on for your knee, that might help a little bit. You want the band to be as close up to that hip joint as you can, so as high up as you can. And then you're going to come out just a little bit, so the band's applying some traction. And then in this half kneeling position, just glide forward a little bit. So as the band creates some distraction away, creating some space in that hip joint, you're just gliding through hip extension and back. And notice in this position, the movement is just coming from the hip joint. I am not arching my low back. I'm not cranking on my low back. I'm just focusing on that movement at the hip joint. So this next one is a hip mobilization into hip flexion. So again, with the band in the same position here, pulling out to the side, you're going to come into all fours, come away from the band a little bit, and then you're just going to sit back onto the heels and come back. So going into that hip flexion, letting the band distract the joint out to the side, and coming back up. Another thing you can do here is rotating away from that band here. Again, coming out just a little bit, and then sitting back on the heels, and opening back up. Back on the heels, and opening back up. So, try those two techniques at home. These are really good to do before a bike ride, especially just to clear out the hip a little bit, create a little bit more mobility range of motion before you hop on that bike, and let us know how it feels.